Friends, I'm going to talk today with you. It's a very pressing issue that is in our Maharashtra state and some other part of southern states in India, particularly facing a health challenge. It's called as a new syndrome, Guillain-Barré, Guillain-Barré syndrome, GBS in short. This is a very chronic development in health. Since this news is past 2.5 months back, it is in public domain. Many people is dying, so a panic are being created. So that's why I wanted to share with you what is this disease all about. The key facts. Since I'm not a doctor, my friend, but I will take the uh, some key points to make you aware from WHO website, World Health Organization website. Actually, on this website, uh, a well detailed documented data is available about this particular syndrome, which is causing India a panic and many deaths. Guillain-Barré syndrome is a rare condition. This is a very rare condition, my friend. This is not a general kind of syndrome, disease. Okay, this is a syndrome which is very rare in nature, in which a person immune system attacks the peripheral nerves. जो the values of immune system, the things which actually protects you from the disease, acting against you and making your system paralyzed, nerves paralysis. What is paralysis? Paralysis is something which makes your nerves deactive. It deactivates your nerves. Actually, this is called paralysis. So this is a immune system response acting against your body. So that's the problem, causing problem. People of all ages can be affected, but it is a more common in adults and in males particularly. Most people recover fully recover fully from even the most severe conditions of GBS syndrome. Okay, several severe cases of GBS syndrome are rare but can result in near total paralysis and breathing problem. When they have breathing problem, there is go for ventilator and other solutions, ICU kind of solutions. GBS is potentially life threatening. Many people is dying. People with GBS should be treated and monitored as quickly as possible. Some may need intensive care units even. Treatment includes supportive care and other neurological therapies. Okay, so I told you some facts and figures. What is the symptom? What is the symptom? Symptoms typically last few weeks, with most individuals recovering without long-term severe neurological complications. The first symptoms of GBS includes weakness. Underlining the key facts is the weakness and tingling sensations. Weakness and tingling sensations. Okay, this usually starts in the leg and can spread to the arms and faces. For some people, these symptoms can lead to paralysis in the legs, arms, and muscles, in face. In approximately one third of people, the chest muscles are affected, making it hard to breathe actually. Okay, the ability to speak and swallow may become affected to the severe cases of GBS. These cases are considered life-threatening when you are unable to take the breathing. Okay, then of course it is life-threatening when your body is getting, you know, deactive. Paralysis is deactivation of your body parts. So that's the problem. You need to have intensive care units for breathing problems. So the doctor does it. Most people uncover fully. Most people recover fully from even the most severe cases of GBS, although some continue to experience weaknesses. Even in the best of settings, a small number of GBS patients die from complications, and which can lead paralysis muscles to control breathing, blood infection, lung clot, and cardiac arrest is even possible. What is the causes? Causes is not known at the fully. Mm, the research is going on, but nobody knows this because since it is rare in disease, so that's why companies and others don't invest into that. So this is also a problem in health sector when there is less patients, 20, 50, 200, 500 companies are not in, you know, okay to go to invest into a lot of money into that. So causes of it is not fully understood yet because of the research, a lack of enthusiasm of the company's private investors, but most cases follow an infection with virus and bacteria kind of system. This leads immune system to attack the body itself. Okay, जो आपको सुरक्षा देता है वो आपके खिलाफ काम कर रहा है. That's the situation. Infection with the bacteria which causes gastroenteritis, nausea, vomiting, diarrhea kind of situation is one of the most common risk factor of GBS. People can also develop GBS after having the flu or other infectious, including Zika virus. Zika virus is since Zika virus is too much, it spreads in Maharashtra and this and that states. So that's why there is a much larger number of patients there. Okay. The rare instances vaccination can increase the risk of people getting GBS, but the chances of its occurrence is extremely low. A study shows that people are much more likely to get GBS from infections such as flu than from the vaccine given to prevent the infection. In this case, the flu vaccine. Okay. Occasionally, surgery can trigger GPS. GPS, okay. Surgery can trigger GPS because immune system activates. Okay, diagnosis the problem. What is diagnosis? Diagnosis, doctor knows that how to diagnose. Diagnosis based on symptoms and findings of neurological examination through the diminishing loss of deep tendon reflexes, a lumbar puncture or electromyography EMG may be done for supportive information, though should not delay treatment. Other tests such as blood tests to identify the underlying trigger are not required to make the diagnosis of GBS and should not be delayed treatment. Anyone who is considering to possible GBS should be closely monitored for respiratory problems actually. Treatment and cure also have been recommended for treatment and cure for GBS system. GBS potentially life-threatening. GBS patients should be hospitalized so as they can be monitored closely. Supportive care including monitoring of breathing, heartbeat, and blood pressure. The cases where the person's ability to breathing is impaired, he or she is put on the ventilator. Okay, the doctor knows that I have already told you. There is no there is no known cure for GBS. Okay, but treatment can be improved through the GPS process and shortening its duration. Okay, given the given the autoimmune nature of the disease, its acute phase is typically treated with immunotherapy, such as plasma change to remove the antibody from the blood, or intravenous immunoglobulin. It is often, it is most often beneficial when initiated 7 to 14 days. Symptom appears. Okay. The cases where muscle weakness persists after the acute phase of the illness, patients may require rehabilitation service to strengthen their muscles and restore the treatment. Okay, so that's all I talked about. There is no complete cure process because there is no investment into that. This is a rare disease, so small numbers of things, people are not, companies particularly are not investing into it. Yes, there is treatment process. Doctor, if at the right time doctor takes the cure, then it can be preventable. Otherwise, it is life threatening because of the problem is severe in nature. So thank you very much. I want to share with you this. Okay, so thank you.